Hello, everyone. Welcome to the lecture on the musculoskeletal system overview and disorders. In this lesson, we're going to explore bones, muscles, joints, tendons, and ligaments, and we'll learn how they all work together to provide support, movement, and protection for the body. First, we're just going to briefly cover the anatomy and physiology, and then we're going to move on to the disorders. These are the learning objectives for this lesson. So before we start discussing the disorders, it's important to review the anatomy and physiology of the musculoskeletal system. So in pathophysiology, understanding what is normal allows us to recognize, obviously, what's gone wrong, right? So we're going to begin with major structures of the system and then examine how bones grow, remodel, heal, and respond to injury throughout life. So the musculoskeletal system consists of six primary structures. You have the bones that provide support, protect the organs, store minerals, and they also store the bone marrow. Joints connect the bones and allow for movement. Muscles generate force by contracting. Tendons connect the muscles to the bones and transmitting the force produced by muscle contraction. Ligaments connect bone to bone, providing joint stability. Finally, you have the bursae. These are small fluid-filled sacs that reduce friction between moving structures such as tendons, muscles, and bones. You don't want bone rubbing against bone, right? It sounds painful. So damage to any one of these structures can impair movement, increase pain, and reduce function. So here's another slide that kind of goes over the different structures of the musculoskeletal system, including bones, joints, and muscles. These are the different types of bones. Although they look different, all bones share the same basic composition. An outer layer of dense cortical bone provides the strength, while the inner network of cancellous or spongy bone, it reduces weight and contains bone marrow. Now, blood vessels, continuously supply bone with oxygen and nutrients because remember, our entire body needs oxygen and nutrients, including bones, making bone a living tissue capable of growth, remodeling, and repair. There are three specialized cell types that continuously maintain bones. So osteoblasts are the builders. They synthesize new bone matrix and deposit minerals, increasing the bone's strength. Once osteoblasts become trapped within the bone they mature into osteocytes. Osteocytes act as maintenance workers, right? They basically monitor mechanical stress and coordinate remodeling. Osteoclasts are the demolition team, basically. They break down old or damaged bone through a process called bone resorption. Now, healthy bone depends on a balance between osteoblast activity and osteoclast activity. So when osteoclasts become more active than osteoblasts, bone density is going to decrease, and this increases the risk of fractures. Now, bone formation begins through osteogenesis, followed by ossification, the process of depositing minerals into newly formed bone. Now, there are several factors that regulate this process. You have mechanical stress from weight-bearing exercise, which stimulates osteoblast activity and strengthens the bone. This is the one regular exercise that helps prevent osteoporosis. Vitamin D promotes calcium absorption from the intestines, providing the minerals needed for bone mineralization. An adequate blood supply delivers oxygen, nutrients, hormones, and growth factors to developing bones. Now, hormones also play a very important role in bones, right? Estrogen slows bone resorption by suppressing the osteoclast activity. Calcitonin decreases osteoclast activity as well, helping preserve bone mass. Parathyroid hormone increases blood calcium by stimulating osteoclast-mediated bone resorption. Now, the growth hormone promotes bone growth during childhood and adolescence. So you can see how hormones play such an important role in bone, development, maintenance, and prevention of osteoporosis. Maintaining healthy bone requires all of these systems to be able to work together. Now, the bone possesses a remarkable ability to heal itself after injury. Healing occurs in four overlapping stages. The first stage is hematoma formation. This is where bleeding occurs immediately after the fracture, forming a blood clot. Next comes the fibrocartilaginous callus formation. So fibroblasts and osteoblasts migrate to the fracture site and begin creating soft connective tissue, which stabilizes the bone. The third stage is bone callus formation. Now, during this period, this is the period where osteoblasts replace the soft callus with woven bone, so it becomes stronger now. Finally, during the remodeling phase, osteoclasts remove excess bone while osteoblasts reshape the bone according to the normal mechanical stress. Now, unlike many tissues in the body, bone often heals without scar formation because the remodeling phase restores much of the original structure. Now let's talk about joints. Joints, also called articulations, are the locations where two or more bones meet. Some joints are called synarthrosis, are immovable, such as the sutures of the skull, right? Then you have amphiarthrosis. These allow only limited movement, like the joints between the vertebrae. The majority of the joints in the body are what we call diarthrosis, also known as synovial joints. These are freely movable joints and include the shoulder, hip, knee, and elbow. These help us to bend our legs and our hips and our elbows. Now, different joint shapes produce different movements. Ball and socket joints allow movement in multiple directions. Hinge joints permit flexion and extension. Pivot joints allow rotation, and gliding joints permit sliding movements. So every type has allows a different type of movement. Now, healthy articular cartilage covers the ends of these bones. This helps to reduce friction and absorbing shock during movement. Now, several structures work together to stabilize and protect joints. The joint capsule surrounds the synovial joints and encloses synovial fluid, which helps to lubricate cartilage. Ligaments connect the bone to bone and they prevent excessive movement. Tendons connect the muscles to the bone, transmitting muscle contraction into movement, the signals that we get from our nervous system. Bursae reduce friction between tendons, muscles, and bones. This happens during repetitive movements. Finally, the fascia surrounds muscles and other soft tissues, providing support, which allows muscles to glide smoothly during contraction. Inflammation of these structures can produce a lot of pain and limit joint movement and function. The knee is an excellent example of a hinge joint. It primarily allows flexion and extension while maintaining stability during weight bearing. Now, the knee depends heavily on ligaments, menisci, muscles, and tendons for stability because the bone surfaces alone, provide relatively little support. So we need these, right? So this reliance on soft tissue explains why ligament injuries and meniscal tears and tendon injuries are among the most common sports-related musculoskeletal injuries. Now let's talk about muscles. Muscles convert chemical energy into mechanical movement. Skeletal muscles attach to bones through tendons and are enclosed by connective tissue called fascia. Within the muscle fibers are repeating units called sarcomeres, composed of actin and myosin filaments. Now, when stimulated by motor neurons, these filaments slide past one another, shortening the muscle and generating force. Muscle contraction requires ATP. During intense activity, muscles rely on anaerobic metabolism of stored glycogen when oxygen delivery cannot meet the demand. This explains why prolonged strenuous exercise eventually leads to fatigue and lactic acid accumulation. Now let's take a closer look at the different types of muscle tissue found in the human body. Although all the muscle tissue has the ability to contract, each type has a specialized structure and function. The first type is skeletal muscle, which is the muscle we'll focus on most in this lesson. Skeletal muscles attach to bones by tendons and are responsible for voluntary movement. Whenever you walk, lift an object, smile, or maintain your posture, you're using your skeletal muscles. These muscles are under conscious control and have a striped or striated appearance under the microscope. The second type of smooth muscle muscle is your smooth muscle, right? Unlike skeletal muscle, smooth muscle is involuntary, meaning we don't consciously control it. It's found in the walls of hollow organs such as the stomach, intestines, bladder, blood vessels, and uterus. Smooth muscle contracts automatically to move food through the digestive tract, for example, regulate blood vessel diameter, whether it constricts or, dilates. And it helps to contract when we need to empty the bladder. Finally, and all of this happens actually automatically, right? Now, finally, there is cardiac muscle, which is found only in the heart. Like skeletal muscles, it's striated, but like smooth muscle, it contracts involuntarily, right? We can't make our heart contract. It does it automatically, right? Cardiac muscle has a unique property called automaticity, autom- automaticity, sorry, meaning it can generate its own electrical impulse and contract rhythmically without requiring continuous stimulation from the nervous system, because remember, it has its own electrical system, right? So all of these muscles differ in location and function. All of them rely on the same basic principle of contraction, and they all require energy in the form of ATP to function. Now, this diagram here shows how skeletal muscles produce movement. Movement begins in the brain, where motor neurons generate an electrical impulse. That impulse travels through the spinal cord and peripheral nerves until it reaches the neuromuscular junction. At the neuromuscular junction, the neurotransmitter acetylcholine is released. This stimulates the muscle fiber. Now, this causes calcium to be released into the muscle cell, allowing contractile proteins, actin and myosin, to interact. Now, using ATP for energy, the myosin heads pull on the actin filaments, causing the sarcomere to shorten. Because a million sarcomeres shortening simultaneously, the entire muscle contracts. Right? It's very articulated. As the muscle shortens, it pulls on the tendon, which then pulls on the bone. This produces movement at the joint. This process occurs in fractions of a second every time you move, whether you're talking, taking a step, picking up a pencil, or blinking your eyes, right? We don't think of all these things happening as we're doing the simple things. So this illustration here basically highlights another important concept about skeletal muscle. Muscles work in pairs. Muscles can only generate force by contracting or pulling. They cannot actively push. Because of this, movement requires opposing muscle groups called agonists and antagonists. For example, when you bend your elbow, the biceps contract while the triceps relax. To straighten your arm, the opposite occurs. The triceps contract and the biceps relax. So this coordinated activity allows movements to be smooth and controlled rather than jerky. Healthy movement also depends on intact tendons, ligaments, joints, bones, and nerves. Damage anywhere along this pathway can impair mobility, which is why patients with fractures, tendon injuries, arthritis, or nerve disorders often experience weakness or loss of function. So muscle is highly adaptable tissue that responds continuously to how much or how little we use it, right? If you don't use it, you lose it basically, right? So even at rest, muscles maintain a slight state of contraction called muscle tone. Muscle tone helps maintain posture, stabilize joints, and prepare muscles for movement. Now, abnormal muscle tone can occur in several forms. For example, you can have flaccid muscles, which have decreased tone and feel soft or limp. This often occurs after lower motor neuron injuries, right? And then you have spastic muscles, which have increased tone and remain stiff because of upper motor neuron damage, such as after a stroke or a spinal cord injury, right? Atonic muscles have virtually no muscle tone at all. Muscles also respond to activity. Regular exercise causes hypertrophy where it grows, right? Where muscle fibers become larger and stronger. Conversely, prolonged bed rest, for example, immobilized patients, or paralysis leads to atrophy, where the muscle fibers shrink because they're no longer being used. This is why early mobility is so important in patients who are hospitalized. Even a few days of inactivity can result in a lot, of bone loss, of muscle loss, sorry. The musculoskeletal system does a lot more than just simply allow us to move, right? First, it provides structural framework that supports the body and maintains posture. It protects many of our vital organs. The skull protects the brain. The vertebrae protect the spinal cord, and the rib cage protects the heart and the lungs. Muscles generate body heat as a byproduct of contraction, helping maintain normal body temperature. Skeletal muscle contractions also help return venous blood to the heart. As it contracts, the venous blood is pumped up back to the heart. This is often referred to as muscle pump, which becomes especially important when we're walking or exercising because as you're standing up or you're exercising, you want that venous blood to return to the heart to get oxygenated, to recirculate. Inside many bones is red bone marrow, where red blood cells and white blood cells and platelets are produced for hematopoiesis. Finally, bone acts as reservoirs for important materials such as calcium and phosphorus. These minerals can be released into the bloodstream whenever the body needs them to maintain homeostasis. Now, because the system performs so many vital functions, the musculoskeletal disorders can often affect far more than just mobility. They can influence circulation, blood cell production, metabolism, and just overall quality of life and functionality. This is a table that just shows some, gerontologic considerations in our older adults, the structural changes, functional changes, and the things that we common, manifestations we see. Now let's quickly talk about the labs and diagnostics done to, assess bone function and musculoskeletal function. So why are labs and diagnostic procedures even indicated, right? Because, we basically different diagnostic studies provide different types of information depending on the suspected disorder. Imaging studies, they show, for example, like X-rays, CTs, they evaluate fractures, tumors, arthritis, ligament injuries, tendon tears, cartilage damage, and herniated disc. Bone density studies help identify osteopenia or osteoporosis before fracture occurs because it shows, basically shows us how dense the bone is, so how strong it is. Lab studies help identify metabolic disorders such as inflammatory diseases and infections affecting bone and muscle. For example, in the case of osteomyelitis, right? The combination of the history, physical exam, lab testing, and imaging, it allows healthcare workers to accurately diagnose musculoskeletal disorders. So the labs that we have, there are several lab tests that help evaluate bone health, calcium, vitamin D. They're essential for normal bone mineralization. Hormones such as parathyroid hormone, and calcitonin, they regulate bone remodeling, as we mentioned. So, it's important to check that. When there's an infection present, inflammatory markers such as white blood cell count, ESR, and CRP, they become very important. The imaging studies include X-rays, which are excellent for evaluating fractures and arthritis. CT scans provide detailed images for complex fractures. MRIs are particularly useful for evaluating muscles, tendons, ligaments, cartilage, and spinal discs. The DEXA scan remains the gold standard, though, for measuring bone mineral density. Results are reported as T-scores, helping diagnose osteopenia and osteoporosis before fractures develop. And as you can see here, this shows you the score. Normal bone density is in the green, +2. When it goes into the negative, there's a high risk for, osteopenia and osteoporosis. So now let's move on to musculoskeletal disorders. Let's first talk about, osteoporosis, right? And this is very common. You're going to come across this in healthcare a lot. Osteoporosis is basically a metabolic bone disease characterized by decreased bone density and deterioration of bone tissue. As the bones lose mineral content, they become porous, brittle, and much more susceptible to fractures, even after minor trauma. The key concept to understand here is that osteoporosis develops because bone resorption exceeds bone formation. Remember osteoclast and osteoblast? Now, throughout life, osteoclasts continuously break down old bone, while osteoblasts build new bone, right? So in healthy adults, this process remains balanced. We need that balance, right? However, with aging, especially after menopause, the osteoclast activity, the breaking of bone, begins to outpace the building of the bone, the osteoblast activity. So estrogen normally suppresses osteoclasts. So when estrogen levels decline after menopause, bone loss accelerates significantly. Other contributing factors include inadequate calcium and vitamin D intake, smoking, excessive alcohol use, the lack of weight-bearing exercises, prolonged corticosteroid therapy, and certain like endocrine disorders can also cause this. Osteoporosis is often called a silent disease because patients usually don't have any symptoms until they have a fracture, and that's when they get diagnosed. That's like the first indication, right, of is often with vertebral compression fracture or hip fracture or wrist fracture. Now, because falls are the leading cause of fractures in patients with osteoporosis, prevention becomes very important, and that's the main treatment technically. So let's connect the pathophysiology to what the patient is actually experiencing. Since bone gradually becomes weaker over many years, patients usually don't feel pain until a fracture happens. One of the earliest signs is loss of height, often several inches over time. This occurs because of repeated vertebral compression fractures, causing the vertebral bodies to collapse. So compression fractures, basically patients could also develop kyphosis, commonly called Dowler's hump, as the thoracic spine gradually curves forward. Compression fractures often produce sudden severe back pain that worsens with movement and improves with rest. Now, diagnosis is made with a DEXA scan. This measures bone mineral density. Remember, a T-score of below negative 2.5 confirms osteoporosis. Treatment focuses on prevention, additional bone loss. Patients are encouraged to consume adequate calcium and vitamin D, participate in regular weight-bearing exercise, avoid smoking, and reduce alcohol intake. The most commonly prescribed medications are biphosphonates, which work by inhibiting osteoclast activity, and they slow bone resorption. Now, ultimately, preventing fractures is the main goal because hip fractures in older adults are associated with significant disability, loss of independence, and increased mortality. Next, we're going to talk about osteomyelitis, which is an infection of the bone. Unlike osteoporosis, which develops slowly over many years, osteomyelitis is an infectious process that can progress rapidly if it's not treated. Most cases are caused by bacteria, with Staphylococcus aureus being the most common organism. The infection will reach the bone through different pathways. For example, a patient might have a pressure injury, stage 4 pressure injury, where the bone is exposed and the infection can get to the bone. So in a hematogenous osteomyelitis, bacteria travel through the bloodstream from another site of infection and lodge within the bone. A non-hematogenous osteomyelitis bacteria, in that one, bacteria enters directly through trauma, open fractures, surgery, diabetic foot ulcers, or orthopedic implants. Once bacteria invade the bone, the body, obviously goes in, triggers an inflammatory response. Blood vessels become dilated and permeable, leading to edema and increased pressure inside that rigid bone. Now, unlike soft tissue, bone cannot easily expand. So as the pressure increases, blood vessels become compressed in the bone. This reduces blood flow. This creates ischemia, which eventually leads to bone necrosis. Necrotic bone has little blood supply, making it very difficult for immune cells and antibiotics to reach that area. This is the reason why osteomyelitis can become chronic and often requires surgical treatment. And patients normally are treated with like long-term antibiotics via IV. Now, patients with acute osteomyelitis often presents with severe localized bone pain, which is not relieved by rest. Remember, the osteoporosis relieved by rest. The affected area becomes warm, swollen, tender, or erythematous because of the inflammatory response. Since this is an infection, systemic symptoms, you'll also see those, such as fevers, chills, malaise, elevated white blood cell count, are also very common. If the infection continues, it becomes chronic. Chronic osteomyelitis causes persistent bone pain. drainage from sinus tracts, recurrent infections, and progressive destruction of the bone. Diagnosis is done through, basically by blood work, such as you'll see elevated ESR, CRP, white blood cell count, along with imaging studies, including MRI or bone scans. The definitive diagnosis often requires a bone biopsy, which identifies the infecting organism and guides the antibiotic therapy. Right, so treatment typically involves 4 to 6 weeks of IV antibiotics, sometimes even longer, depending on how intense the infection is. Now, when significant necrotic bone is present, surgical debridement becomes necessary because antibiotics cannot adequately penetrate that tissue. So if the treatment is delayed, complications can include sepsis, pathologic fractures, chronic infections, and in severe cases, amputation. Now let's talk about osteoarthritis. This is the most common form of arthritis. Unlike rheumatoid arthritis, which is autoimmune and inflammatory, osteoarthritis is primarily a degenerative disease caused by gradual wear and tear of articular cartilage. Articular cartilage normally provides a smooth, low friction surface that allows bones to glide over one another during movement, right? So now over time, repetitive mechanical stress causes this cartilage to break down. As this becomes thinner, the protective cushion between the bone disappears. Eventually, bone begins directly rubbing against bone. This constant friction stimulates new bone formation along joint margins, producing osteophytes, commonly known as bone spurs. Because osteoarthritis is primarily a mechanical disease, it usually affects weight-bearing joints such as the knees, hips, spine, and hands. Unlike RA, osteoarthritis is often asymmetrical, affecting one joint more severely than another, whereas in RA you have simultaneous joints affected at the same time. Patients typically report joint pain that worsen with activity and improve with rest. Morning stiffness is usually brief, lasting less than 30 minutes, but that's a hallmark sign. As degeneration progresses, patients develop decreased range of motion, crepitus, which is a grinding sensation during movement, enlargement of affected joints. Diagnosis is usually done through X-rays showing narrowed joint spaces, osteophytes, and cartilage loss. Treatment focuses on reducing pain, maintaining mobility, weight reduction when needed, and physical therapy. NSAIDs and joint infections, usually the use of NSAIDs, joint injections, and eventually joint replacement surgery for advanced disease when nothing else works. So now let's talk about trauma to the musculoskeletal system. We talked about, arthritis and osteoporosis and all that, osteomyelitis infection. Now let's talk about trauma. Muscular skeletal trauma is involved in almost 77% of injuries, and the most common are sprains from sporting injuries. Main cause, it cause impaired mobility and sensation, and impaired activities of daily living. So let's start with strains, one of the most common musculoskeletal injury. A strain is an injury to the muscle or tendon. Remember, tendons connect muscles to bones. So whenever a muscle contracts, the force is transmitted through the tendon to produce movement. Strains typically occur when a muscle is overstretched or overloaded. This can happen during sports, lifting heavy objects, repetitive movements, or even sudden awkward motions. Depending on the amount of tissue damage, strains are classified into 3 grades. Grade 1 strain involves microscopic tearing of only a few muscle fibers. Patients usually experience mild pain with little loss of strength or function. Then you have grade 2 strain, which involves a partial tear. Inflammatory response becomes much more pronounced, producing swelling, bruising, muscle spasm, and weakness. And then we have grade 3 strain, which is a complete rupture of the muscle or tendon. Because the tissue is completely torn, patients often lose the ability to actively move that affected, area, and surgical repair is usually required. Now notice how the symptoms directly reflect the degree of tissue damage. As more fibers are torn, inflammation increases, pain becomes more severe, and function will decline. So now let's compare strains with sprains, right? Sometimes we confuse these two injuries, but the difference is quite simple. Strains involve muscles and tendons. Sprains involve ligaments, right? Strains, tendons, Sprains, ligaments. Ligaments connect bone to bone and provide stability to the joints. When excessive force causes a joint to twist beyond its normal range of motion, the ligaments stretch or tear. So like sprains are classified also into three grades. Grade 1 is mild stretching with minimal instability, right? Grade 2 causes partial tearing of the ligament fibers, producing swelling, bruising, pain, and decreased joint stability. Grade 3 sprain is a complete ligament rupture. The joint becomes unstable because one of its primary stabilizers is lost. So the ankle is one of the most commonly sprained joints because it has to support the body weight while allowing movements in multiple directions. So all those strains and sprains involve different tissues. Their treatment is very similar during the acute phase, So diagnosis begins with physical examination, followed by imaging studies. X-rays help rule out fractures. Ultrasound or MRI provides a better visualization of the muscles, tendons, and the ligaments, right? Then initial treatment will follow, with the RICE principle: rest, ice, compression, elevation. NSAIDs may also be prescribed to reduce pain and inflammation. And then grade 3 sprain injuries often require surgical repair, followed by weeks of immobilization and rehab. Physical therapy is really important because simply healing the tissue isn't enough. We also have to restore the strength, flexibility, and normal movement. So although many strains and sprains heal without difficulty, complications can develop if the injuries are severe or not managed properly. One common complication is bursitis, which is inflammation of the bursa, a small fluid sac that reduces friction between moving tissue. Repeated irritation can also lead to tendinitis, basically meaning inflammation of the tendon itself. The most serious complication is compartment syndrome. After trauma, bleeding and swelling increase the pressure within the closed muscle compartment, which is surrounded by the fascia. Now, because the fascia cannot stretch very much, the pressure continues to build. Eventually, the pressure exceeds the capillary blood pressure, cutting off blood flow to the muscles and the nerves. Now, without oxygen, these tissues are going to start dying within hours. Now, this is considered an orthopedic emergency and requires immediate surgical decompression through a fasciotomy. Now, remember, the classic warning signs: severe pain that is disproportionate to the injury, pain with passive stretching, numbness, pallor, pulselessness, paralysis, and paresthesias, the 6 Ps. So now let's discuss fractures. Fracture is simply a break in the continuity of the bone. Healthy bone fractures only after significant force, but weakened bone, as seen, for example, in osteoporosis, can fracture with minimal trauma. Fractures are classified in several ways. A complete fracture extends completely across the bone. An incomplete fracture extends partially through the bone. A closed fracture keeps the skin intact, but it's fractured underneath. An open fracture, called a compound fracture, basically it breaks through the skin. You can see the broken bones sticking out. Open fractures are particularly concerning because now the skin is open, bacteria can enter directly into the bone, which increases the risk of osteomyelitis. Now, different fracture patterns include spiral, transverse, oblique, comminuted, impacted, green stick, avulsion fractures, and these reflect the direction and the magnitude of the force that caused the injury. Here is a picture of the different types of fractures. So the bone healing follows a sequence very similar to wound healing, right? Immediately after injury, bleeding forms a hematoma around the fracture. Inflammatory cells migrate into the area and begin cleaning the damaged tissue. Fibroblasts and osteoblasts produce a soft fibrocartilaginous callus. This temporarily stabilizes the fracture, right? But that's not going to be there permanently. Now, as the healing progresses, osteoblasts replace the soft callus with hard woven bone to stabilize it. Finally, during remodeling, osteoclasts remove the excess bone, and osteoblasts reshape the fracture site according to the normal mechanical stress. Healing usually requires several months. Factors such as smoking, diabetes, poor nutrition, infection, and poor blood supply. Blood supply can significantly delay this process. And that's the reason why it's important to educate our patients to manage their chronic diseases, avoid drinking, smoking, and getting proper nutrition. So the goal of fracture treatment, is to restore normal bone alignment while allowing the bone healing to occur. Some fractures can be treated without surgery using a closed reduction, where the bone is manually basically realigned before applying a cast or the spring. Now, more complex fractures require open reduction and internal fixation, commonly called ORIF. During ORIFs, the surgeons expose the fracture through an incision and stabilize the bone using plates and screws and rods and pins. And pin care is extremely important with these because they can get infected. Patients with severe soft tissue injury may, instead require external fixation where the pins pass through the skin and attach to an external frame that holds it together. Now, throughout treatment, maintaining proper alignment and immobilization is extremely important because excessive movement can delay healing.